In the meantime, Moderna joining the fight against COVID. Its vaccine rollout is underway. Millions of doses are being... Meg Terrell joins us right now. She's got more on how that rollout's going. Meg, good morning.
Good morning, Becky. It is the second week that coronavirus vaccines are making their way across the country. 5.9 million doses of Moderna's vaccine this week, joining 2 million more doses of Pfizer's vaccine. And that's on top of the 2.9 million doses of Pfizer's vaccine that went out last week. So altogether, by the end of this week, we should be approaching 11 million doses in the U.S. distributed. Now, as of yesterday, the CDC has started reporting administered. And as of yesterday at 1 p.m., 2.8 million doses had been distributed, 556,000 administered, and that is expected to climb, of course, as this moves into nursing homes and the pace and the cadence of administering really starts to get established. And the reason that 2.8 million might be more than perhaps expected is there are more doses per vial than people expected at the beginning, more than 5. So there's 6 and even 7 sometimes. Also, over the weekend, the CDC meeting wants to vote to recommend Moderna's vaccine, and then again on Sunday to talk about who should be in the next priority group after that very tippy top with healthcare workers and people who live in nursing homes. And what they ended up voting on was people who are 75 years or older and frontline essential workers. So there's 30 million people in that frontline essential worker group, 19 million people who are over 75. And the way that they characterize frontline essential workers includes first responders, people who work in education like teachers, support staff, and daycare workers, people who work in food and agriculture, manufacturing, corrections workers, postal service workers, public transit, and grocery store. And then essentially in the next tier will be those other essential workers you can see on the right, which includes media, guys. We'll see how that goes, as well as people who are at high risk of the disease and people who are age 65 to 74. Now, this was, of course, an agonizing decision for this committee, having to decide who might come next. But, of course, the supply of these vaccines is going to be limited at the beginning. They're going as fast as they can, but they won't be able to get to everybody for a few months, guys.
Hey, Meg, it's a really interesting question. Obviously, there are going to be some questions that are raised about this and people who are probably pushing back. We just had an epidemiologist on, Dr. Levy, and he suggested that really the first people that we should be looking at would be anybody age 65 and up, not 75 and up like that, anybody age 65 and up, because that's where 80% of the deaths from COVID are coming on this issue. And then people with comorbidities, because that's another 15% or something of where these deaths are coming up. He said those are the people that are clogging up the hospitals. That's why we are having such a problem with this right now. And if you could get at the fatalities, if you could bring that number down, that would be the success story. And I think that's the type of questions you're going to see raised immediately now that the CDC is weighing in on this.
Yeah, I mean, it's been a debate that's been raging, I think, all week leading up to this meeting. And, you know, the CDC grappled with it. I mean, this committee, the ACIP committee, what they did was they were trying to balance essentially the reduction in morbidity and mortality, and that's where you get the age-related question and the underlying health conditions, versus preserving society's ability to function, and that's where the frontline essential workers come in. So really trying to do some of both with these allocations, with the 75 plus and the frontline essential workers, including teachers, trying to ensure that school can go on in person, things like that. I mean, these are the kinds of societal decisions this group was working on. And then, of course, it is up to each state what it wants to do. They can take the recommendations or they can go their own way. So we're bound to see differences in all the states with this, too.
I would get one tomorrow. I would get one tomorrow, Meg, obviously, if it were to come. But I heard in your voice a little bit of a snicker when you said essential employees. You couldn't even sell that when you said media for essential employees. I could hear it in your voice. You're like, who made that up? I mean, we are not worthy compared to.
No, Joe, I just know how eager you are to get your shot, and I wanted to make sure you knew your Group 1C. I mean, I don't know how old you are, but I assume you're not over 75.
Anyway, my point was that's a stretch. Essential workers, that's a stretch. Although I'm ready to take one.
Shepard Smith here. Thanks for watching CNBC on YouTube.